Hey, we're the Turd Nerds. We're glad you're here. Before we take the plunge, let us introduce ourselves. I'm Dr. Rebecca Sand, a naturopathic physician and licensed acupuncturist specializing in digestive, microbiome, and hormone conditions and integrative fertility.
I'm Dr. Ami Kapadia. I'm a medical doctor trained in family medicine and functional medicine with a special interest in combining standard therapies with lifestyle and nutrition-based interventions.
And I'm Dr. Alana Gurvich, a naturopathic physician, licensed acupuncturist, and a fellow of the American Board of Naturopathic Gastroenterology. I specialize in IBD, IBS, and other functional GI disorders. Let's dive in.
The following discussion is for educational purposes only and not intended to diagnose or treat any diseases or conditions. Please consult your doctor before incorporating any of this information into your care. The information presented on this podcast is not medical advice.
We are joined today by Dr. Crane Holmes, who is very tall.
In case you weren't sure which
He's a little
one.
taller than me.
Yeah.
He's feeling a little bit cramped in our studio. I just want to tell you guys about how I've known Crane for a long time. I've known him since he was getting trained, but Crane has this very, very important subspecialization, and I end up referring to him a lot. Crane is also, just like me, a fellow of the American College of Naturopathic Gastroenterology. And so we specialize in chronic GI disorders. And when I have a patient that I am just stuck on, I've tried all of my things, all of my testing, all of my tricks, and I don't know what it is, I am like, oh, this is chronic mold or chronic Lyme. You should go see Dr. Crane Holmes.
Thank goodness for Crane.
And so when we were kind of thinking about who we should invite in and what are these chronic GI conditions that we haven't talked about, I think that I want to focus on both chronic mold today and then chronic Lyme presentations of the GI tract in our next episode, because they are there.
Yep.
They're so important, and I don't know what to do with it.
And we're both from Pennsylvania, where there's a lot of Lyme.
Yeah, lots of Lyme.
Not that you can't get it in Oregon.
And we're all living in Oregon, where there's quite a bit of mold.
So let's start.
Deadly duo.
Let's try to keep this conversation focused mainly on mold. Okay, so let me tell you what I know, and you tell me where I'm right or wrong.
Mm-hmm.
So when I have a patient that it looks like SIBO, it sounds like SIBO, I test for SIBO, it's not SIBO, the next thing I'm thinking of is fungal overgrowth.
Yep.
How does mold affect the GI tract?
Yeah. So I think mold, right? I feel like the new hotness right now and everything that we do is like the whole idea of mast cell, right? So I think a lot of mold is driving mast cell, which is then driving a lot of digestive inflammation, which is then driving a lot of people's digestive symptoms,
So that's
right?
histamine. That means histamine.
So
for a lot of our
explain
listeners.
how mast cells or
Mhm.
histamine presents, and then talk to us about mold.
Yeah. So, I mean, you're 100% right? People are coming to us with digestive symptoms, right? They're coming to us with bloating, gas, weird poops, like whatever that looks
Food
like.
sensitivities.
Yep, all of the things. And then trying to figure out like why, right? Like why everyone's like, I don't want to just be on these diet, right? Why? So you do the SIBO things, right? You try the Candida things and see what happens there. And when it's like people still aren't like, or they backslide as soon, right? Then we're thinking about the mold, then we're thinking about the Lyme piece. And I think it's just that same idea where like the inflammation inside the digestive tract, right? These critters are just blowing up all the time. These immune cells are blowing up all the time. And people are feeling that as bloating.
Yep.
That's is kind of like the
So
simple
you
way.
think one of your keynotes to look for mold is chronic bloating that doesn't respond to all the other things?
I would say that bloating can be a common symptom that we see with mold. The thing that really I think sets aside things like mold for me from things like SIBO, I feel like my classic SIBO patient when SIBO is 90% of their issue is when you do your ROS, like your head to toe headaches, sinus issues, sleep issues, hormone issues. They're usually like, no. Like all that stuff
They're
is
just
like,
blood.
yep.
Yeah.
They're like
Candy
pretty
pops.
fine, right? Like I'm pretty fine. It's really just my gut. But when you start to go do the head to toe and they're like, oh yeah, and I have this, and I have this. That's what makes me think
Sounds a lot like me, Crane.
something else going on.
Oh, wow.
Maybe you should go see.
I'm also postpartum. Is it
Yeah.
mold or is it postpartum?
I will also say I've known you for a long time. This does sound like you.
Tune into our sleep episodes.
So that's what makes me think of it is like when it's not just gut stuff, when there's other things going on.
What are other keynotes that we should be looking at to key us into it?
Yeah. So, I mean, and that being said, right, there are a lot of people we've all seen, those SIBO patients where you treat their brain fog does get better, their sleep does get better, right? Like all this stuff does get better when it just doesn't, right?
Well, it often gets better with antihistamine.
Yep. And it
support.
certainly can, right?
Yeah.
And it certainly can. That's maybe could point you down that direction of like maybe some, like, 'cause I don't know about you two, but do you think that SIBO drives mast cells or drives histamine?
No,
It's the
I
same.
don't see that correlation as much. Do you?
Yeah, CFL.
Yeah, I would say CFO for me. The mold and
Yeah.
histamine. I mean, can you explain a little bit how the mold and the histamine overlap with each other?
Well, You mean just like the symptom picture?
Yeah, or like how
Oh,
does one trigger
well,
the
like
other?
Crane said, the mold is like one of the drivers of histamine overreactivity. It's just the cells get irritated. There's more mast cell activity, and then there's more histamine release. The more any of those bugs you have, it sounds like you guys don't see as much with SIBO, but with Candida or mold or Lyme or any of those infections, it can drive the histamine response. So the histamine's like a more the end product of like the underlying triggers, and the mold and the stuff Crane's going to talk about are like the things driving that pathway. That's one of the pathways that drives down.
Other question I have is, so when I'm doing testing, really the only reliable testing that I have, and I'm not going to say it's reliable, I'm not going to say it's good. It just happens to be the only testing that I use. And I'd love to know your opinion about that too, is I use the Candida immune complex and the Candida IgG, IgA, and IgM based on one of our first episodes. I think it was episode 1, 2, and 3.
Yeah.
Were Candida 1, Candida 2, Candida 3.
SIBO.
When we're talking mold, we're not just talking Candida.
Right.
So can you just elaborate on that?
Yeah, distinguish them and what's the difference?
Yeah. So what I tell people is like, right, Candida is a type of yeast is a type of mold. So they are in the same family. And I think commonly, this is actually a little, so I do also run the Candida antibodies, and I do also run the Candida immune complexes. My little like thing that I haven't quite figured out is I have seen people whose antibodies are negative, but their immune complexes are positive. Right. And it does make me wonder, could there be some cross reactivity where there's something in their environment that's pinging their immune system to look like this thing that could be reacting to
Is
their
that mold?
maybe. That's the thing. I don't know. Like that'd be my guess, but I don't know.
Do you use those for determining progress, or do you just do like a one-time test to see if it's part of the problem?
Yeah, I think it's kind of like, I say it's like a strep test. It's either positive or it's not.
Yeah, that's kind of what
I will also say I have had immune complexes and IgGs go back to normal limits. You know, like, so and I think initially I was testing every 3 months.
Yeah.
And then I had a patient who I sent over to Crane, who I'm managing all her other stuff, and Crane is managing the mold Lyme thing, right? And the patient was like, oh no, Dr. Holmes told me not to test because it never goes down. And I was like, I think now every 6 months.
6 months could be more. 6 months could be more reasonable. My concern is I think it's like a lot of these other bugs. It's like, I also say I treat people, I don't treat numbers, right? Because so there is that thing that I just worry about, that like,
I like that.
yeah, right. That like people just I just want people like, hey,
Step on that.
you feel better.
Yeah, because I don't know, for some people, maybe it doesn't go away if they just have chronic immune reactivity, even if they're feeling better. But it is interesting that you've seen it go down in people, but then does it stay down, or like
It's
they're
a more
feeling?
complicated process.
Yeah.
Because you could still have an immune response to it even if the mold is gone because of environmental issues. Right?
And then the other thing I'm always looking at is if I see IgM, I'm thinking there's environmental triggers. Like there's acute reactivity right now.
I mean, that research, when I looked at that stuff, there was only research for the immune complex and the IgG for this particular usage, but it's not like there's like all these studies on it, you know, so who knows?
Yeah. And like I say too, right, like what we're seeing, right, we all have Candida as part of our normal microbiome. It's supposed to be there, right?
Yeah.
So when we're seeing these immune cells present, that tells us like our body's like, whoa, dude, like you're pushing your boundaries, right? Like we're now having to come back. And then, you know, we're coming in behind it with our nystatins and our azoles and our grapefruits, right? And all these things try to push it back.
Right.
So when I say when we're retesting, it's like what we're seeing guards at the castle gate, right? Like we want them to be there. They don't know if the dragon is just like in its cage in his hole, like hiding, right? Or completely gone. So the fact that we still see the soldiers still hanging out there,
It's okay.
it's okay.
It is a drag. I would agree with that.
A drag and a dragon.
Yeah.
Yeah.
Okay. And then how do you so Candida versus mold, is there a better way to detect molds?
That's the $1 million question, right? So, I mean,
There are a lot of tests on the market.
Absolutely. And I think this is like my perspective, at least, is like, right, there's urine mycotoxin testing. I'm sure that could be part of the puzzle that we talk about. And that tells you like, are you peeing out levels of mold, right?
Gross.
What that doesn't tell you though is like, is it actually a problem or not, right? Like you could be peeing it out, but like, is it actually causing your symptoms, right? I'm partial to actually just testing people's space.
Yeah.
Okay. Can you talk? That is such a complicated thing. Can you talk us through that?
So my 2 cents is like, if we test your space, and my preferred test is something called an ERMI test. It's an environmental relative moldiness index test. It's a dust test, right? And it's a DNA test. Okay, so it looks for the DNA of mold spores, mold species in your living environment.
So active, alive, or dead.
Active, alive, or dead. Yeah, like I said, it could be like an arm of a bug that's like left over, right? It could be an active mold, you know, like colony. It's a dust test. So
Okay.
it's like a Swiffer cloth. Like they ship you a Swiffer cloth to your house, and you dust your house, and you
And you
mail it
dust
back
room
in.
by room by room?
So it's a good question. So the test is around $200. You can be like, okay, I'm gonna take one cloth and do an upstairs test and a downstairs test. So that'd be a $400 test, right? You could be like, is it my base, right? Like you can test check you can be like, right?
Yeah.
If you have all the money in the world,
Then
you
you
can
don't
keep
know where it
testing.
is. If you do your whole house, you don't.
Well, you could do them in different swabs.
Yeah.
A different swab for each separate place you want to.
Ka-ching, ka-ching, ka-ching.
Yeah.
Yeah.
But the problem too is even if there is mold, like let's say in your bathroom, there's mold, like yes, it's obviously helpful to know there's mold in your bathroom, but the idea is, right, you could fit 200,000 mold spores on the head of a pin. Even if there is mold on your bathroom, it's in your whole living space. Like it's in your whole entire house. So then you kind of find it a little bit everywhere.
So your preference before running any urine test or blood test, including the Candida panel, or you'd start with a Candida panel?
I always start with a Candida panel because it's usually inexpensive. It's easy. We're usually testing other markers in the blood as well, right? So I that's usually the first place I start. And then, for a lot of people, right, we have the conversation and a well is like, okay, let's start with the most obvious thing, right? Like if you've never been treated for SIBO, let's start with SIBO. If you've never tried antifungal treatments, let's start there.
Yeah.
And if things still don't, right? You come back, we all have those patients where they come back and they're like, nothing.
Yeah.
Right. And you're like, this really should have done something. Like if this was the problem, this really should have done something.
I have a colleague who is a friend of mine, and they had mold exposure in their office. And then they bought this house, and the house had like a bunch of fireplaces, and they were like, oh, the fireplace was built wrong, right? And I was like, dude, you got to check for mold. And nobody wants to do it. Like they never want to admit that mold's the problem, right?
Because it's expensive. That's
why.
why.
And there's not I never liked that the urine mycotoxin test. I feel like all these people were using it when they come up with all these scenarios like, could be negative because of this, or it could be, and they would have all these, and it made no sense to me. I was like, why are you even doing this test?
Yeah.
So I agree
this
with
lab's
Craig.
a better one. That lab's a better one.
Just check their space and it's a very frustrating process. So thanks for being our local.
What if people lived in mold for like all of their college years or things like significant exposure in the past, but maybe not present?
Yeah. And that's why testing the space is so important, right? Because if you test your urine, and let's say it is high, was it that college dorm that you lived in, right? Like, is it your office? Is it your house, right? Because I tell people on the whole, dealing with mold, if mold's your main problem, isn't hard. The hard part is limiting your exposures, right?
The hard part
the hard part is limiting your exposures, right? But if you know where you're getting because it's once you understand where your exposures are coming from, I say it's like peeling the water out of your boat, right?
Okay, wait, let me back up. Let's say, how much am I worried about the college exposure 40 years ago versus the acute exposure now?
Yeah, asking for a friend.
I'm asking for both of you. Both of you have treated a lot of mold.
Some people have it doesn't affect them. Like, I think they're genetically, some people don't get post-Lyme, even though they got infections. And so I think some people, it's literally has no effect on their life. And then other people, they get one exposure and they're down for 40 years.
Okay, so what I'm not hearing an answer. The question was, how much do
you personally? I don't think you were affected by our college mold.
I actually don't think I'm very sensitive to mold. I would agree with that. How much do I need to prioritize a patient's exposure 30 years ago, but they are not exposed now? We check the house, it looks good.
Then it shouldn't be that hard to treat them.
Yeah. No, so you're right. I mean, it's right. Step one is limit your exposure. So if they're not being exposed, step one's already done. And now it's peeling the water out of their boat. It's, it's binders, it's detox. It's just getting maybe the residual
maybe
issues out.
The antifungals that you use,
nasal
whatever you
sprays.
guys use. Yeah.
Okay, so let me just finish my story about my colleague. So the colleague finally, after years and years, and he's saying,
this could be one of any 50 people.
It could be one of 1,000 people. You need to check. They finally checked their house, and against their will, they brought out remediators. The process went on forever, but they are like, oh my God, I can think.
Yep.
Oh my God, I have energy. Like just cleaning up the house.
I can eat food again.
Yeah, I mean, just cleaning up the house.
I mean, we're in there a lot of the time, especially in Portland. Like in the wintertime, you're in there so
and
many hours.
In their office and in their house.
Yeah.
Okay, so I have an idea of testing Candida, yes. House, yes. follow-up question on testing the house. There is an Ermi and a Hermi.
Hurts me.
Hurts me. Can you explain those?
What a horrible name.
Yeah. Yeah.
Hurts me too.
Yeah.
Hurts me three.
Yeah.
That's what it's called.
Really hurts me.
So the Ermi is a more extensive panel.
Okay.
The Hurts Me are 5 molds that are contained within the Ermi. So oftentimes if you order an Ermi test, it will include the Hurts Me because those molds are already being tested. It's just, I mean, that's the biggest difference. A lot of people run them differently just because of cost.
Right.
Like the Hurts Me is like 100, where the Ermi is like 200.
Are those 5 in the Hurts Me the ones that are more likely to cause human damage?
Yes.
Okay.
Yeah, they are kind of like your bigger, better molds, right?
Got it.
But like Ami was saying, like this is like a rough guesstimation, but it's like around 20% of the population really lacks genetics to deal with molds, right? And the other problem is
They're all natural. I'm just kidding.
yeah,
And
yeah.
functional medicine doctors.
Yeah. And we just don't know. We don't know people's individual level of sensitivity, right? We don't know, like for you, right? You could be working in a moldy office and you feel fine. Maybe you're snuffy.
Luckily, your office is fine and your house is fine. What I told you.
If everybody knows what I went through building out my office, it is definitively not moldy.
Okay, your colleague could be working.
Yes,
could be
okay,
working
okay.
in a moldy office, right? And they could be totally fine, but their front desk staff is like
Right.
right, and having issues.
So you think 20% of the people, they exposure, their body cannot clear the molds?
I wouldn't say one exposure. I would say like if they're going back or they're having repeated exposure. That's why I use the boat, right? Like if you get a splash of water in your boat, like your body could probably, it'll dry out in the sun, right? But if you're constantly getting water in your boat, like it's going to get to a point where like, oh, now the water level is getting higher. Other things are getting wet. Like you're seeing, right? Now the boat's starting to sink a little. Like,
Yeah. Okay. So we've been through testing. We've been through exposure. Can we move on to what to do about it? Because we're about halfway through the episode. Is this a good time?
Yeah, I'll have more questions, but yes.
Okay.
Yeah.
So what do you do about it?
yeah. So again, like step 1 is really limiting your exposures. Like that's kind of the biggest thing. And the conversation I have with a lot of people is like, I mean, right, we all live in this world, like the amount of money that people are spending on more SIBO tests, more stool testing, more supplements, more whatever, right? And I tell people, I'm like, you could just have a window in your house that's leaking and you spend $5,000, right? Which down, but like, and to your point, spend $5,000, you're done.
Right.
Yeah.
As opposed to hundreds of dollars of supplements
Over and over and over and over and over.
I have pill burden. I barely take anything.
No.
Do you take anything?
Magnesium and vitamin D when I get there.
Just what you're saying.
Just what I'm saying.
Yeah.
50,000 I use. That's my protocol. Okay. So treat the mold. Okay. You've treated the mold and you're one of these people who you're still having symptoms even after you get your windows
Treated the mold
replaced.
in your house.
You've treated the mold in your house.
Yep.
You've replaced and you've cleaned.
Yep.
Because cleaning is a big thing.
Yeah, I mean, it sounds like Crane does more. Like I would just defer all of this to an environmental consultant, but it was very hard to find someone regularly for us. So I think it's nice that Crane like walks people through the testing. I would just like defer all of that to the person because it's kind of its own science.
Yeah.
Like the amount of info. So at one point I was using like this amazing woman in another part of the country that no longer wants to work with our patients. So you find somebody, you stick with them, you get to know that like there is a group of people that are very good if you could find them to do that whole.
Just as a little disclaimer to our patients, I really trust environmental toxin people who don't make money doing hair.
Yeah, you want someone
You
different.
want it to be
like
Two different people.
Chinese firewall. You know what I mean? Like the people who detect the mold should not be the people who are remediating the mold. Because those people are going to find a lot more.
It's a very good point.
Yeah.
And the people who just want to fog your house, they also don't know what they're doing.
I don't know explain this fog the house concept.
They would just do evaluations on people's houses and then the test would be positive for on the Ermi or whatever. And then they would find no source. And then they would propose these $10,000, $15,000 fogging of these like natural agents to say it's going to treat it, but then they never actually found the problem.
Hiring? Are they hiring?
Hopefully they're out of business.
So it's a cold. So they call it a cold fogger. So it literally looks like a smoke machine.
Okay.
Wow.
Like it microparticles mist.
What's the substance?
So the natural, it's like thyme oil. There's a couple other brands that kind of like make
It's
different.
not like hydrogen peroxide or something like that.
No. So and that's like what we're kind of alluding to. You can't really kill mold. So 2 things. One, I think air sampling sampling isn't the best
Super important.
type
Thank
of
you.
testing.
Uh-huh.
Because again, like if we're putting an air sample machine in this, right, but the mold is 2 rooms over in the wall, you'll just never catch it, right? And the same thing's true with those petri dishes, like those little like auger plates that people will put out. Like same thing. And the other thing too is unless you're moving the dust, moving the stuff throughout the house, it's also hard to catch it. So and you're right. Like I typically tell people, like I'm a human health expert, not a building health expert, so I try to stay out of it. But
Yeah.
there's just a lot of misinformation.
Yeah,
out
and it's
there.
hard to find someone off the bat who's going to help them do it. So the fogging can be good after you get it cleaned up, but it's not going to treat the source of the problem if they don't find the source, you know?
So step 1, get an assessment, see what's happening in your house. Step 2, remediate or fix wherever the leak is so the entry point comes out. Step 3, clean it using a specialist.
Small particle. Or you can do it yourself if there's protocols.
Maybe step 4 is a fog.
And that's part of the cleaning
That's part
process.
of the
And
cleaning
some people could do that. Some people could do it themselves. It's not the hardest thing.
Yeah.
But the problem is too is it's sometimes like even in my space, I dealt with mold. The leak was already fixed, right? The fact the roof was leaking was already fixed. The fact that the big thing that actually one of the biggest culprits I see is people's shower ducting fan that's done improperly. So they might have a fan, they might run the fan, but it's just
Yeah.
blowing into their attic, or it's
Super
like right.
Yeah.
And
It's so messed up that they build like that in America. I don't think they can anymore, but at some point, I guess that wasn't code, but it should be venting to the outside space, not into the attic.
Okay, so now I'm back to, as a human health specialist, not a building specialist, what's your process to address the mold?
Yeah, so it's a good question. I mean, it's all the things that we do for normal people, right? But it's limit your exposures and binders and detox, right?
Okay, so talk to us about binders, talk to us about detox.
Yeah. And the other piece that could be really helpful for some people is sinus treatments as well, right? Because the other thing that we think about too as GI health experts, right, is the microbiome, right? And we think about like the gut microbiome and the skin microbiome and the sinus microbiome. It's all the same microbiome, right? And the sinuses are just another one of those like wet, moist, damp places that things
into your digestive.
and things just like to hang out in, and it's
leaky. Okay, so what's the first thing you do? Are you going to start with sinuses? Are you going to start with binders? Are you going to do them all at the same time?
Yeah, I start everybody on glutathione, which is a big detoxification support, right? It can for some people,
Are you
and
doing liquid?
it just depends on where the person's at, right? So even for some people, I might start with NAC or I might start with milk thistle, right? It kind of starts on their level of sensitivity, right? And it kind of goes back to the mast cell conversation that, I mean, I have some patients that I start with the liquid and I have them put like a little bit on their finger and lick it off and start with that amount.
Yeah.
Because I've seen people feel terrible from just that little bit amount, right? Versus the capsules obviously is like a one size fits all program and they would feel extra terrible, right? So it really just depends on where the person's starting
I
from.
was talking to one of my colleagues who happens to have a supplement line, and his whole thing was, I don't believe glutathione by its nature, if it's not liposomal, it's going to get broken down in the GI tract. If it's liposomal, it's very expensive, but it might get broken down in the GI tract. So his preference is to use what he calls glutathione precursors. And so that's cysteine and cysteine, glycine, and NAC, I think, because those are all the precursors that in the body make glutathione. This is a shout out to Dr. Jeff Clark, by the way, who is kind of a mad scientist genius. What do you think about that?
Yeah. I mean, and especially if you hope that people can tolerate amino acids, right? So same thing. So for people who are maybe more sensitive, like, starting with amino acids could be an awesome treatment,
So why glutathione? What's that doing?
Yeah, so it's helping to pull the toxins from the cells. It's helping to pull the mold toxins from your cells so that you're actually getting it, stripping it from the cells in some ways, or from the liver, from the tissue, right? And mobilizing it so that you can then get it out of the body. And then that's where you usually pair it with binders, right? I say binders. We're all old enough. Remember those terrible toys we had as a kid where you'd give the guy a mustache with pencil shavings or magnetic shavings, you would draw it.
Yes.
Like that's kind of what binders are. They have different magnetic affinities to different types of species, right? Of different types of species. So that's why there's blends of binders, right? That's why it's not like you don't just do charcoal or chlorella or because they have different binding affinities depending on what you're trying to bind.
Okay, but I've always heard that for mold, the only thing you need to do is chlorothyramine, period, full stop.
Yeah, I see a lot of that too.
Yeah, it can be one of the better. I mean, it's one of the more researched binders for molds.
Yeah.
So yeah, I mean, absolutely. But also I kind of fall into the two things. One, I don't know if you've ever tasted cholestyramine. Speaking of things,
we talk about it a lot.
Things are gross.
It also can constipate people.
Yeah, it's not the most tasty thing in the world, right? And some people just do better with just swallow 2 pills. Even they make binder clays that you also disgusting in my opinion. So, and with everything that we do, it's just like, what are people going to stick with?
What about psyllium?
Yeah, I know.
That was my
used
question,
to,
Dr.
You knew I was
Sand.
going to ask. You knew I was going to ask.
Yeah,
My best
psyllium,
friend psyllium.
psyllium, Saccharomyces boulardii, steamed kale. There's like research on using
Wow.
steamed kale. Okra could be a binder for
That's
people.
probably a hard sell for some too.
steamed kale.
A cup of steamed
Yeah.
Coolest.
Yeah. Well, and that kind of goes back to your conversation. You mentioned like, oh, that one exposure you had, or you're right. And then like, that's where sometimes it is just that matter of like, talking to your patients around like, you know what, that fiber that you already do, like your diet is already rich in a lot of other things. Like you're giving your body, you already have the tools in your system to deal with that.
Yeah. Right. Okay. So binders, glutathione, herbs, antimicrobials. Where does that play in?
Mm-hmm. And I think that a lot of that's like, I mean, it really depends on what their symptoms are, right? And I think it's kind of a case by case thing. I have seen some people use nystatin, like write the medication in their protocols. Some people feel like because nystatin only treats candida and doesn't treat mold, that it can actually cause some mold issues, right? Because if you decrease the candida counts, and then there's other types of mold species in your body, could they then take over more space? But there's also debate on like, does mold actually colonize you? Like, do you actually have mold in your body, or is it just sort of an immune system response to the mold, right? So that's where like, using treatments, may or may like killing it may or may not be necessary, depending on if it's like actually in your tissues or if it's just an immune system response.
Are you more likely to have other dysbiosis if you have mold like SIBO or other issues in there that are worth going after for people?
I would think so. And the other thing too, I tell people, right, because we talk about candida immune complexes and fungal patients, right? I think there's a lot of similarities,
Right.
and I do wonder, like, if you're living in a moldy house or working in a moldy office, is this candida like, oh, we love this place, right? Like we are just like happy as a clam. Like we are just growing in your sinuses and your gut and in your skin.
You don't need to breathe. Let's just turn that off.
So uncomfortable.
Right?
Yeah.
So yeah, absolutely. Like, it's just like that perfect environment.
Yeah.
And that's part of why I do what I do, is because like, you see those patients who do great on antifungals, they feel so good. Right. And as soon as they stop, a lot of their stuff comes back. And it makes you wonder,
the terrain.
is something else going on?
And so, okay, we're going to have Crane back to talk about Lyme. Is that when you start thinking that there's a Lyme disorder?
Exactly.
Ooh, spoiler alert for next episode. Okay, I have a couple more questions. I have actually,
Yes.
do you agree with what Crane said?
Yeah. He's doing all the right. I'm glad someone else is doing this. The biggest challenge I found with patients is that so many of the houses in America have issues.
Yep.
Yeah.
It's usually the crawl space or the basement.
Mm-hmm.
That's number one. The attic is probably number two, or a misducted dryer vent or a misducted vent from the bathroom going into the attic is probably number two. And for some reason, at some point, they stopped making good overhangs for windows, or else like in our house, the overhangs are huge. So even if there's a window leak, there's not a window leak because the water's hitting the overhang. So at some point, people developed all these weird aesthetic things for houses, like complex roof structures, flat roofs. Like, I don't know what they're doing. Plus, we build out of paper, which in India, my cousin is like, what are you guys doing over there? Like
modern homes.
They use concrete and brick and steel, which is what we should be doing if we want to use that house for like more than 100 years. Like most of our houses are kind of old.
Bleach and water, because everyone, the whole internet's like, just bleach and water takes care of it.
We have to find the source is the problem. So you need someone who knows how to evaluate a basement and or a crawl space, evaluate your attic properly, make sure there's not vents that are misducted. But the biggest problem I found for most people was under the house because the air moves up. The attic, all attics are kind of moldy. That's not a huge problem. You don't want a duct that's messed up, but the air comes from below you. So it's really important you have like a properly treated, or like the crawl space should be outside of the house or inside of the house. Too much for right now.
Like it should be kind of
either in or out. It should be in or out.
What is a crawl space? I don't think I know.
You don't know?
No, I don't think I do. What is it?
It's like they build a lot of houses on dirt floors, and then there's a piece of plastic over it. And that's it. So all the stuff from the soil, whether it's wet or there's microbes or whatever, is going to come into the house. So people in the country that are that actually like engineers say it should be in or out, meaning like you either condition it and seal it so it's part of your house, or you have almost like a wall as your floor.
Everybody, because I don't think I have a crawl space.
You don't have one.
Okay.
I don't think you do. You have a basement. You don't usually have both. Some houses have both.
Oh, it's under the house.
It's under the house. Under the house is the biggest problem for most people.
Okay.
The other thing too is, right, it was like, I mean, we've had like, think about in the Northwest. So I talk about the Northwest, like you've had creeks and streams and water flow down, and then they
Yeah.
just put a house here and expect to keep the environment completely out. So then you have standing water in your crawl space. You
Right.
have things that are in
Right.
your house, basically.
Yeah, and it can be really hard to fix that problem.
This is like the beginning of my nightmare / horror.
I know.
I'm sitting
yeah.
here like, when's your next opening for a new patient? You know,
Mhm.
It's-
Yeah.
Your house is fine. I've been in your house so many
I know.
times.
Mold freaks me out.
No,
It
your
freaks
house
me
is
out.
fine.
I will tell you that what I am afraid of is mold followed by Lyme, or maybe Lyme.
So, Crane, where can people find you?
Yes, please.
Yeah. So I have a private practice in Northeast Portland. I also am the owner and clinical director of the SIBO testing center. So, I wear both hats, right? And that's why I feel like I like talking about this topic, because so many people come to me for SIBO, and I'm like the
Right.
third or fourth or fifth person they're seeing. And I'm like, maybe we should go bark up a different tree. Maybe there's
Totally.
something else going on.
And so where do they find you? What's your website?
drcraneholmes.com.
Crane like the bird.
Crane like the bird, pdxgi.com. But yeah, it's crane like the
That's a
bird.
good one. PDXGI, that's a good one.
Thank
That
you.
is a good one.
Mm.
Well, we are going to have Dr. Holmes back to talk about Lyme disorders because he happens to be the stuff of nightmares. Thanks, Stars, for joining us.
Thank you.
Thanks for joining us today. Stay tuned. We release episodes every 2 weeks.
If you like this episode, please subscribe and don't forget to rate and review us to help spread the turd nerd word.